Republic TV made an announcement that we will dedicate the 6 p.m. slot to taking your questions on Republic and trying to answer as many questions as possible. Today's subject is children and COVID. So if you're an expecting mother, if you're pregnant, or if you have an infant, a child, and you have questions, this next segment is dedicated to you. Let me introduce our panel this evening. Dr. T.B. Singh, who's a senior gynecologist, joining us live from Kolkata this evening. Dr. Archana Sangekar is joining us. She's a pediatrician at the Dr. Valsekar's clinic. She's joining us live from Mumbai this evening. Dr. Sanjeev Bagai, who's a senior pediatrician and chairman at the Nephron Clinic. And Dr. D.K. Gupta, who's a pediatrician and CMD at the Felix Healthcare, joining us on the show this evening. I thank, first of all our doctors for being a part of this broadcast, a dedicated broadcast on Republic. Let me get straight to the question. So what we've done here at Republic TV, doctors, is we've asked people to write into us and we've collated some of these questions. And in the course of the next 20-25 minutes, I will put 2 questions to each one of you, and you can answer each one of those questions as briefly as possible so that we can answer as many questions as possible. My first question to Dr. T.B. Singh. First question, what do we know about the present COVID strain and young children? Dr. Singh. Second, are kids more at risk now more than ever before, or at least what we've seen in the first wave? Dr. T.B. Singh, the first 2 questions to you.
Right. So good evening, everybody, and thanks for having me here. Frankly, to answer this, I think it's mainly a pediatrician who should be answering that question. But what I know from my pediatric colleagues, definitely we've seen cases in young children. We never saw that in the first wave. So definitely, we think this strain is more vicious. Probably we are dealing with something like a Formula One racing car. This virus is fast, it's accelerating, doesn't stop at bends, and we really don't know what to do. It's quite evident from the number of beds that we don't have. And I'll certainly say that, yes, I think the strain is affecting the young children. It is not just a disease of the old anymore.
Okay, Dr. Singh, because you're a gynecologist and you're the only gynecologist on the show, I'll just push in one more question to you. If a pregnant woman is COVID positive, how does it impact the baby in the womb? There's a question that came in. Another question that came in, can a mother breastfeed the child when she or the child is COVID positive?
Yeah, so I think when we look at COVID per se, whatever studies we have with us, we don't see a deleterious effect on the baby. As such. So we, in fact, reassure our patients and tell them, look, if you're COVID positive, you're not a severe case, mild case, moderate case, we do know that the baby probably is going to come out fine. Breastfeeding, definitely we recommend it. You must breastfeed your child. And if you're COVID positive at that time, well, wear a mask, keep all the hygienic factors in mind, but definitely feed your baby. And that brings me to another important aspect which I want to touch, and that's vaccination. And most of the questions I'm getting is about vaccination. So we do recommend vaccination in the lactation phase. We do recommend it also in pregnancy now. And we do recommend it also even if you're contemplating to get pregnant. We have limited data, but whatever we have from the Western world. If you look at the CDC, they have studied in about 90,000 women. And they've found that their vaccine, the Moderna and the Pfizer, seems to be pretty fine. So they are getting their pregnant women vaccinated. And my patients who are there in the United States, I've also recommended them to get the vaccination done. If you look at the United Kingdom, probably we have the AstraZeneca there, so they don't have much information about that. But they do believe there's nothing to prove that these vaccines would cause a deleterious effect to the baby or to the mother. And probably the benefits outweigh the risks. So definitely go ahead with your vaccination, go ahead with your lactation. And if you're contemplating pregnancy, well, that shouldn't stop you from taking a vaccine too.
Okay, let me ask the next set of questions to Dr. Archana Sangekar. Dr. Archana, what are the first symptoms in young children? One of the questions that came in this evening. And how is the present strain impacting babies and infants?
So the common symptoms that we are seeing, in fact, with this strain, we are seeing children are presenting with more symptoms than they did in the last wave, right? So they are presenting with all the symptoms that adults are presenting with: sore throats, fever, cough, headache, body ache, loss of smell, loss of taste. So yeah, it's the whole symptomatology which adults see. But they are all recovering. So they're getting and the symptoms last for 2 to 3 days, and generally most children recover after this.
And do you have any data or any information on whether the present strain is impacting babies and infants more?
In my practice, I've seen more young children, not babies.
Okay. The next set of questions I'd like to put across to Dr. Sanjeev Bagai. Dr. Bagai, what are the first signs of COVID to look out for infants? A question came in. Also, when should an infant, child or teenager get tested?
Hi, good evening. As the discussion is progressing, just to take off from the previous speakers, children in the first wave, most studies have shown 2 to 11% of the total global population. This year, we have seen upwards of 22 to 25%, and there are certain states, especially in US, where the data analysis is done, it's in clusters, it's reached 73%. Children are known to carry the same viral load, but transmitted 17 times more within the households. Now, the earlier symptoms were, what we understood in children was basically cough or breathlessness or fever, but most of the children now have more of gastrointestinal symptoms, loose motions, vomiting, stomach pain, rashes, more like vasculitis kind of rashes, cold, clammy, and cold extremities. Some of them have even got altered sensorium. And after a patient recovers, sometimes they have come with presentations 7 to 10 days later, which involves the cardiac and the neurological functions. So there are 4 kinds of presentations which happen in children. One is what we call as multisystemic inflammatory disease. The second is what we call as pediatric inflammatory systemic disease. The third group is what presents like Kawasaki disease, which is basically an autoimmune inflammatory disorder. And the other one is a mixed picture, which we call as Kawasaki-like disease, which comes approximately 5 to 10 days later. And about 10% of children if they have COVID, tend to have long COVID. That means it spills over well into 3 to 6 months after recovery. So we have to have a very high index of suspicion.
Yeah.
In presence of fever, we normally don't ask for a RT-PCR as a nasopharyngeal swab right on day 1 of fever. We generally wait for 2 or 3 days. The important thing is just to stick to paracetamol as a drug for fever, not to give anything else apart from that, and have a daily consultation, at least on the phone, with the parents to see the feeding habits, urine output, and the saturation of children, and to isolate them.
Okay. Next two questions I'm going to direct to Dr. D.K. Gupta. Dr. Gupta, viewers asking if the symptoms are also of generic flu, how does one know, or how does one realize when to go in for a COVID-19 test? Another question I'd like to put to you: if a child is COVID positive, what's the course of treatment? Dr. Gupta.
That's a great question, I think. Any influenza-like illness means any child suffering from cold, running nose, cough, throat pain, headache, fever, vomiting, pain abdomen should be tested for COVID-19 until and unless proved otherwise. This is the first suspicion. We should think that it could be COVID, and we should rule out first COVID, then we should think of other diseases. We know that there are other abnormal symptoms or atypical symptoms, as discovered Dr. Bagai also. The child can present, small child can present with lethargy, loss of appetite, irritability, excessive crying, poor crying. Maybe there will be running nose, or maybe there will be skin rashes, discoloration, blue discoloration of lips and the toes or fingertips. Or there can be sometimes there is a pediatric systemic inflammatory syndrome also that presents the red eye, conjunctivitis, red and crackle lips, and swelling of fingers and toes, and sometimes pain and abdominal vomiting. So these are the symptoms. We should always suspect COVID whenever these symptoms, 1 or 2 symptoms, are appearing in your child, and we should immediately contact to a nearby doctor. What are the emergency signs? We should also know. those children, those are special children, those are suffering from comorbid conditions like juvenile diabetes mellitus, asthma, pneumonia, HIV, cancer, sickle cell anemia, thalassemia, dialysis, kidney problems, transplants, they should be at high suspicion and they should immediately go to the emergency room if they have any type of the symptoms. The second question was, what will be the line of treatment for this patient, COVID patient, pediatric COVID patient especially? There is no specific line of treatment. Even we don't have prevention right now. That vaccine is not available for children. Therefore, the treatment is prevention is best treatment right now. We should always isolate the children. If anybody is contact or suspect in a family or positive patient in their family, they should be isolated. Patients should be isolated and children should be away from these patients. And second is, if there is symptom, then the symptomatic and supportive treatment which currently we are having, like if patient is having running nose or cough or cold, there should be anti-allergic syrup, they should be prescribed with the doctor's advice only. Second, paracetamol as discussed by Dr. Bagai, whenever there is a fever, you can give paracetamol 6 to 8 hours as per requirement. Or if very dehydrated, then should give ORS or plenty of fluids. And if there is any sign of dehydration, poor appetite or lethargy, irritable cry, or the persistent vomiting, persistent loose motion, persistent pain, or redness of the eyes or red circle, any syndromic symptoms, then you should immediately contact your nearby doctor.
Okay. Dr. Gupta, one question coming in for Dr. T.V. Singh. He's a gynecologist. What precautions do pregnant mothers have to take at this time? Dr. Singh.
Stay at home. All my pregnant women, they want to travel, they want to go all over the place. No, stay at home. The only weapon we have against this virus is wearing a mask and maintaining social distance. We don't have, a bullet, a magic bullet. I wish we had. We don't have the right antiviral to hit this virus. So the best thing to do is to protect yourself. And that's what I request all the pregnant mothers of this country to do. Please stay away, please wear your mask, please maintain the hygiene, and try to keep yourself in a good mood, eat well, sleep well. So that's what everybody should be doing.
Okay. Next question, next set of questions to Dr. Archana Sengekar. Dr. Archana, viewers writing in now, asking about oxygen requirement for kids. At what level does one have to worry? Second question I'm going to push is the use of steroids an option for kids in the fight against COVID-19? You can take those two questions.
Yeah, so right now, the saturation levels which you would worry about is below 92, when I would want the child to go to the hospital. At 95, 96, 95 to 99, of course, we don't worry that they should, the monitoring should happen twice a day, and they should keep the pediatrician involved every day. And what was the second question?
The second one was, is the use of steroids an option for kids in the fight against COVID-19?
No. Presently, the only treatment for children is supportive care. So it is paracetamol as and when required for the fever. And supplements like, your vitamins and vitamin C and vitamin D. We don't know if that really helps, but yes, that's what we're using.
Okay, next set of questions to Dr. Bagai. Dr. Bagai, if an adult is positive at home, should asymptomatic children at home be tested? And secondly, what additional precautions need to be taken at homes with kids?
Okay, so the golden principle is if anyone within the same household, within the same family, same household is positive, after the person tests positive, either on day 2 or day 3, the entire household, including the helpers at home, should be tested. Now, if a child, even if he's asymptomatic, we know that almost 75 to 80% of the overall positives of COVID are asymptomatic. Even if a child is asymptomatic, they tend to carry the same viral load as symptomatic children. There is no difference. What we need to look out for is very subtle signs. And even if a patient recovers as a baby or a child or an infant, we need to continue the monitoring at least for 10 days after a child has tested negative. Primarily to look out for what we call as a Kawasaki-like disease. Although it is rare as a follow-up, but still we will keep a watch on it. There is no specific medication apart from paracetamol. Most of the vitamins have no given role in it. Just normal diet, good nutrition, and try to keep the child as far away from the index positive family member as possible.
Okay. Last question to Dr. D.K. Gupta. What additional precautions need to be taken in homes with kids? And secondly, how does one quarantine safely with their child? These are two questions that are coming in the course of the show.
I think at every home we should have SOP for infection control at home. Like whenever you're coming from outside, you should have a sanitizer that should be installed outside your gate, and you should do proper hand hygiene before entering or touching even the gate. After entering, you should have a demarcated or earmarked room where you should change your clothes and you should take bath, and after changing the clothes, and you should come to your children and you should have contact after doing all these things only. And always train your children regarding COVID appropriate behavior. Children are very trainable, they are very good followers. They follow their parents or their siblings and make them do things like playing like a game, and they will learn fast. And definitely, what was the next question?
Yeah, the follow-up question to that was how does one quarantine safely with their child?
Yeah, definitely. You can put mask older than 2 years age. If their child is more than 2 years, you can put mask on the children also, but less than 2 years, you cannot put. But definitely, if somebody who is positive, he should be away from the children. If child is positive and it is less than 2 years, it is very difficult to mother to be separated from the baby, and mother, even breastfeeding mother can breastfeed the child also. Mother should put mask, double mask properly to protect her or even to protect children. If mother is positive, then she should protect the child. If child is positive, then she should protect herself also. I have seen the cases where child is positive, in seeing holes, and there is a media person whose child is positive, everybody is negative. Then it's very difficult to quarantine these type of situations. And you have to take all precautions for yourself. The child cannot put mask every time, and you have to take care.
Okay, I'm going to try. I have time for just one last question. Let me try and put that to Dr. Singh. I know even he has to go. All doctors have to go right now. So let me ask one last question, Dr. Singh. What additional precautions need to be taken in homes with kids? What additional precautions need to be taken in homes with kids?
I think probably got to make them understand what's happening, because for kids it's quite a frustrating time, psychologically also. They really don't know what's happening. As my colleague Dr. Gupta mentioned, when you have a slightly older child, about 3 years, probably you can tell them to wear a mask, especially at this particular time. I think most of our children are at home and they're having their online classes or whatever happening at home. So they're really going out. So the basic protocols that we are following, wearing a mask, keeping our sanitizer close by, these are the minimal tools that we have. Apart from that, of course, sleeping well, eating well, being mentally happy. So some sort of exercise has to be brought about by the parents and by the family to make these children understand that this is a different time and a difficult time. I don't think there's any wonder drug. There's no wonder medication. I wish we had it. So precaution is basically what we have to follow. We have to be very careful, very vigilant. This strain is definitely different. Very unlike the first one.
Yeah, follow the basics. Dr. T.B. Singh, Dr. Archana, Dr. Sanjeev Bagai, and Dr. Gupta, thank you for joining us on this special broadcast on Republic TV. On a daily basis, we will take your questions and ask the experts. Today's subject was pediatricians and gynecologists.
Hello.
Tomorrow, we will take up one new subject every evening at 6 p.m. Thank you very much.